How does palindromic rheumatism, inflammation, compare to RA? Imagine your joints acting like a switch that turns on and off. That's a good way to think about how palindromic rheumatism and rheumatoid arthritis differ. Both are inflammatory joint conditions, but they behave very differently. Palindromic rheumatism involves sudden, short bursts of joint inflammation. These episodes, called flares, usually last only a few hours or days. During a flare, you might notice swelling, pain, and warmth around the affected joint, often in the fingers, wrists, or knees. Once the flare ends, the joint typically returns to normal, with no lasting damage. These episodes happen intermittently, with symptom-free periods in between. It's like your joints are taking quick, unpredictable trips that leave no permanent mark. In contrast, rheumatoid arthritis is a long-term, ongoing condition. It causes persistent inflammation that affects multiple joints on both sides of the body. The symptoms tend to last 4 months or even years without complete remission. People with RA often experience prolonged morning stiffness, swelling, pain, and tenderness that gradually worsen over time. Because the inflammation is continuous, it can lead to joint erosion and deformity, which might cause lasting disability if not properly managed. Another key difference is how these conditions affect the joints over the long run. Palindromic rheumatism generally does not cause permanent joint damage or erosion. Even after many flares, X-rays usually show no signs of joint destruction. On the other hand, rheumatoid arthritis can cause joint erosion visible on imaging, leading to deformities and loss of function. That's why early diagnosis and treatment are so important in RA to prevent irreversible damage. Both conditions can have positive blood tests for rheumatoid factor and anti-citrullinated protein antibodies. These markers are associated with autoimmune activity. Interestingly, having these antibodies in palindromic rheumatism can sometimes suggest a higher chance of developing rheumatoid arthritis later on. Studies show that around 28 to 67% of people with palindromic rheumatism may eventually develop RA or other connective tissue diseases, especially if they have these antibodies. In terms of who is affected, rheumatoid arthritis is more common in women, while palindromic rheumatism affects men and women equally. Palindromic rheumatism can be seen as a potential early stage or warning sign of rheumatoid arthritis. Some people experience palindromic episodes first, and over time, their condition may evolve into a more persistent form of RA. When it comes to managing these conditions, palindromic rheumatism often requires less aggressive treatment during flares since it doesn't cause lasting damage. Anti-inflammatory medications can help control symptoms, and in some cases, disease-modifying drugs might be used to prevent progression. Rheumatoid arthritis, however, usually needs early and aggressive treatment with disease-modifying antirheumatic drugs to control inflammation and protect the joints from erosion. To sum up, palindromic rheumatism involves episodic, short-lived inflammation that leaves no permanent damage, while rheumatoid arthritis is a chronic, ongoing disease that can cause joint destruction and disability. Recognizing the differences helps doctors tailor treatment plans and monitor for potential progression. If you experience joint symptoms, it's always best to consult a healthcare professional for a proper diagnosis and personalized care.